I'm Dr. John Weston, and along with our staff at Weston Eye Center, we do our best to keep your vision at its best.
When you scheduled your surgery, you were given a surgery center tote bag with a number of items. First of all, the video on DVD you're watching now, a surgery guide which goes into detail about what to expect and what to do before and after surgery, several bottles of eye drops, an eye shield and wraparound sunglasses, and one prescription that you will need to fill at your drugstore. Finally, an eye drop instruction sheet and checkoff list or calendar should be in the bag as well. If there are any missing items, please call our office so that we can provide them. There are a few main things that we're going to review. Number one, the eye drops. Number two, how to protect your eye so that it will heal properly. And number three, how to avoid any problems or other complications.
Now we're going to go over a lot of details in the rest of the video, but all of it's covered in the surgery guide. And of course you can review this video at any time. If you have any other questions, feel free to give us a call. Now sit back, relax, and we'll go over the information with you. While the number and brand name of the drops in your bag may vary, you will be given several bottles to soothe and help your eye heal. You will also have a prescription for an antibiotic drop that helps avoid infection. Please fill that prescription as soon as possible. You will begin using all of the drops 2 days before surgery.
The eye can only hold one drop at a time. Hold down the lower lid to make a little pouch.
Keep the eye closed for a minute or two to allow the drop to sink in. Wait at least 5 minutes before using another drop so as not to dilute the effect.
At first, it may be difficult to get the drop in the eye, and you might want to practice with the artificial tears provided. It may also help to refrigerate the bottles. It may sting a little less.
Refer to the How to Use Your Eye Drop sheet for further details. You'll notice that we want you to use the drops in the morning of your surgery and resume the schedule when you get home later that day. Use the drops as indicated on the checkoff calendar. Let us know if any of them run out before expected so we can make sure to get you some extra medication. It's important to remember to keep up with the drops and shield the eye when you're asleep. To put the shield on, place a long strip of tape above the shield diagonally from the opposite forehead toward the ear on the side of the surgery. Do this both to the top and the bottom of the shield. When not using the eye shield, you can wear your old glasses or the sunglasses, whatever is more comfortable. Lifting light objects is not a problem, but avoid anything that makes you strain in the first week to avoid putting pressure on the eye. For example, a grocery bag shouldn't be a problem, but moving a heavy box or furniture might be. Be careful of pets and grandchildren. They won't know that it's important to leave the eye alone right after your surgery. Chlorinated water can be irritating to the eye and can still have bacteria in it. So for the first week after surgery, avoid swimming pools, hot tubs, and showering where water can get in the eye to avoid irritation or infection. Now we've reviewed the do's and don'ts that are going to help the eye heal. Just use common sense. You've had major surgery, and it's going to take a little while for the eye to settle down. The best Band-Aid for the eye is the backside of the eyelid, so keeping your eyes closed the day of surgery is going to be really helpful. You can expect some mild discomfort. A little bit of grittiness or aching is not unexpected, but should be gone by the next day when you can resume your normal activities. Just remember to put the shield on while you're sleeping and use all those eye drops, and everything should settle down quickly.
We want to thank you for the trust you have placed in us. We will do everything we can to help things go smoothly during your healing period. If you have any problems or questions, please let us know. Again, thank you,
and we'll be seeing you soon.